Little Sarah and her sister Maggie are in the ED because of persistent cold and flu symptoms, runny nose, sore throat, and a fever.
Fevers are usually designated as temperatures greater than 100.4. Hi Sarah, I'm Dr. Hami.
Dr. Jim Hami sees many kids come into the ED because of fever. But he says these days, with most kids having been vaccinated against many common and dangerous illnesses, the height of the fever doesn't always correspond to the severity of illness.
For the majority of children, parents should never use the fever as the sole indication to bring them into the doctor.
For example, he says he's more concerned about a listless child with a low temp than a more normal-acting one with a higher temp.
So it's really important for a parent to look at their child and assess how they're acting and interacting with them compared to what they normally are like, and make decisions based on that and not so much based on the fever.
Look for other symptoms such as difficulty breathing, very poor fluid intake, severe pain, vomiting, or if your child is listless or not responsive. And it's important to be extra vigilant with newborns.
Any temperature over 100.4 in that infant less than 2 months, sometimes 3 months if they haven't had their vaccines yet, is going to be a trigger for you to bring them in.
Dr. Hami says you should also bring in your child if symptoms suddenly get worse or if a fever goes away and then comes back, as that could be a sign of a secondary infection such as pneumonia, which may require treatment with antibiotics. Most kids do get better on their own, so the key is to help relieve symptoms.
So you can treat your child with appropriate doses of either ibuprofen or acetaminophen.
If your child is not up to date on vaccinations or has health problems such as being immune compromised, do see a doctor if fever is present. For Mayo Clinic News Network, I'm Vivian Williams.